Hello, everyone. Welcome back to Channel Dad Reads and more information about the C virus that cannot be named. And my last video, the Woodstock video, is doing pretty well. People really like it. I know we got some comments both ways, and that's awesome because the conversation is what we need to have, folks. We need to not, I know there's some crazy kooky theories out there, and instead of just banning the speech, we need to talk about them and understand why they're crazy and kooky so that people learn. So this is from the Gateway Pundit, although it quotes some other stuff. So this is by Jim Hoft on the Gateway Pundit. And I just came across this today, and I'm releasing this video probably on Monday. So study led by D.A. Henderson, the man who eradicated smallpox. So this is no scientific slouch here, right? This is not some goofball like me who's just reading stuff on the internet and going, well, let's do this. This is someone who really knows his stuff. Found draconian lockdowns for flu pandemics ineffective and even destructive. Now, this is something that has been said for months. This is known in the medical community. Okay, this is known by people who actually do research and have patients and observe what's going on. Okay, the so-called experts who stay in a lab and just play with their test tubes, they don't know anything. D.A. Henderson was an American medical doctor, educator, and epidemiologist who directed a 10-year international effort from 1967 to 1977 that eradicated smallpox throughout the world. So you anti-vaccine people, you can suck on it. Henderson was later the dean of Johns Hopkins School of Public Health. Before his death in 2016, Dr. Henderson authored a report on pandemics and the value of lockdowns. Now, so this is something that people have done, and people will bring this up with the Spanish flu of it's actually starting in 1917 through I think 1919 or 1920 is when it finally eradicated. They tried to do some of this lockdown BS. Now, granted, when that stuff hit the U.S., you had a lot of troops coming back from World War I who were bringing it with them. So you actually had waves of people, and so they would recover, and then another wave would come in. So you have to take that into account. So, now, granted, this is something from a while ago. Draconian lockdowns for pandemic flus were rejected as ineffective and destructive in a seminal 2006 paper on infectious diseases and socioeconomic grounds by serious experienced epidemiologists led by D.A. Henderson, who eradicated. Okay, so this is being repetitive. So here we're going back to 2006. Okay, so this is, like I said, this is known. If you listen to what they say in your biology class about how viruses work and how they spread, you will know that and if you listen to how the immune system works, you should know that squirreling people away will not work. Now, if you're sick and kind of squirreling, then what? But again, this is part of what they found with the Spanish flu. When they put people indoors, they got worse. When there was sunshine, because the vitamin D is so important. And this is part of what we're rediscovering in many ways, the science behind all this stuff that ancient peoples knew. If you don't have your body chemistry right, anything can kill you. And now some things screw up your body chemistry so bad they kill you no matter what. But that is what's going on. And there are no historical observations or scientific studies that support the confinement by quarantine of groups of possible infected people for extended periods in order to slow spread of influenza. It is difficult to identify circumstances in the past half century where large-scale quarantine has been effectively used in the control of any disease. And this is because basically you can't fully isolate. Someone has to come in and out. There has to be interaction. And it only slows things down. In the case of a flu, it makes it worse. So when it comes, none of people are exposed. And now what we've done with our economy, it's going to get worse in the fall because this is the stuff we should have gone through in February and March. And we've just delayed it. That's all we've done. The negative consequences of large-scale quarantine are so extreme: forced confinement of sick people with the well, complete restriction of movement of large populations, difficulty in getting critical supplies, medicines, and food to people inside the quarantine zone, that this mitigation measure should be eliminated from serious consideration. Home quarantine also raises ethical questions. Implementation of home quarantine could result in healthy, unaffected people being placed at risk of infection from sick household members. Okay, and this is exactly what happened in the nursing homes in New York. So here you have a 2006 study that says this is what is most likely going to happen, and that is exactly what happened. They locked the sick in with the well, and they just got everybody sick. In the case of people with this current virus, the weakened immune systems and states that people were in, they died from it. Okay, and practices to reduce the chance of transmission, hand washing, maintaining a distance of 3 feet from infected people, could be recommended, but a policy imposing home quarantine would preclude, for example, sending healthy children to stay with relatives when a family member becomes ill. Such a policy would also be practically hard on and dangerous to people living in close quarters where the risk of infection would be heightened. And that's also what happened in New York. Now, people will bring up Tokyo and other places. They didn't shut down, and they told people who were sick to stay home. Okay. So that's the thing. Now, the mask wearing is ineffective too. I know people will bring that up. Yes, they wore masks in Tokyo and other places, but that is not what got it down. What got it down was keeping the sick away from the healthy. During seasonal influenza epidemics, public events with an expected large attendance have sometimes been canceled or postponed, the rationale being to decrease the number of contacts with those who might be contagious. There are, however, no certain indications that these actions have had any definitive effect on the severity or duration of an epidemic. And this is Woodstock, okay? Now, I know Woodstock was in the summer, but it was in the middle of the epidemic. And yes, the worst parts of it in the U.S. had already passed, but people were still getting sick. And granted, it was out in the sunshine, but it also rained, and there was some, lot of people close together. Were consideration to be given to doing this on a more extensive scale or an extended period, questions immediately arise as to how such events would be affected. There are many social gatherings that involve close contacts with other people, and this prohibition might include church services, athletic events, perhaps all meetings of more than 100 people. And this is exactly what we've done. It might mean closing theaters, restaurants, malls, large stores. Okay, Implementing such measures would have seriously disruptive consequences. Schools are often closed 1 to 2 weeks early in the development of seasonal community outbreaks of influenza, primarily because of the high absentee rates, especially in elementary schools, and because of illnesses among teachers. This would seem reasonable on practical grounds. However, to close schools for longer periods is not only impractical, but carries a possibility of serious adverse outcome. And I've heard many parents, my kids have been out of school for years, but many parents, especially high school kids, juniors and seniors, and especially if they play sports, they are seriously affected. Their futures are being affected by essentially the closing the schools. Okay. And now this year's graduates don't get to have a graduation. They don't get to participate in that. They don't get to have that experience. Now they'll get over that part of it, but where are they for next year? What are they behind? That several months of learning they didn't get. What does that mean against others when they're competing in college or whatever? Thus, canceling or postponing large meetings would not likely to have any significant effect on the development of the epidemic. And then when you have a media that heightens what's going on, okay, and has everybody freaked out, because it's one thing if the people who are running such an event say, you know what, we're going to shut down or we're going to do something. Let's say a church decides, we're pretty packed for 2 services. Let's have a third service, or let's have a service in the afternoon for other people so that people can still come, but we don't have to sit so close together. That is voluntary. That's fine. And they can discuss what they want to do themselves, but just to have the policy. And this is what we've seen in states. And I live in a purple state. Okay. And, DeWine has pretty much screwed us. Now, we're not off as bad as Michigan. We're not quite as far as people being upset, but our economy is tanking very rapidly. And cross country, now it's up to 35 million Americans out of work. Okay. Those jobs don't come back as soon as everything opens. It's not like we can open on Monday and by Friday, everybody's got their job back. Many of those jobs, there's some of those jobs I don't think will ever come back because you've got lots of places that have gone out of business. And if the economy's not doing well, getting a small business loan to open a new restaurant or something like that, in particular, if these fears are still there, banks aren't going to make that kind of loan. So there's lots of places that are closing, and it might be a decade or more before another small restaurant opens. Now, you might get a big chain that puts another restaurant somewhere, but you're not going to get your local business. And those are the better places to go anyway. And I prefer to go to the locals, or if it's like a small chain or something that it's locally owned, and but I prefer local stuff. The problems of implementing such measures are formidable, and secondary effects of absenteeism and community disruption, as well as possible adverse consequences such as loss of public trust in government, which is exactly what we're seeing with all of the demonstrations, and stigmatization of quarantined people and groups, which we're seeing. And this is also where we're getting people who don't wear masks in public. Some people are ridiculing them. We've seen people get arrested over it. People don't trust people, and even though the masks are completely useless. Now, if you have an N95 mask, really, if you haven't been trained how to use it properly, you are really endangering yourself. Now, the other mask, you don't rebreathe your CO2 as much, say in the cloth masks or some of the, let's say the surgical ones, where it's really, they're just really to keep you from spitting on a patient. That's all they're there for. Okay. If this is why, if you ever see surgeons will wear, especially if blood's going to squirt or something, nowadays they'll wear face shields and they wear all that other stuff. That's what protects them from any blood splatter. And granted, if their mouth's open, obviously all of it wouldn't get in, but they still have problems. Okay. Experience has shown that communities faced with epidemics or other adverse events respond best with the least anxiety when the normal social functions of the community is least disrupted. Absolutely. And we're starting to see reports of people that isolate, especially those that are fully isolated. People are going literally crazy. We see suicides are already up. The economic impact hasn't even fully been felt yet, and suicides are already up. Drug use is already up. This is what they're talking about. And this is exactly what our governments have created. A manageable epidemic could move toward catastrophe. In Asia during the SARS period, many people in the affected communities wore surgical masks when in public, but studies have shown that the ordinary surgical mask does little to prevent inhalation of small droplets bearing influenza virus. Okay, that's surgical. So if you're making homemade stuff, it's even worse. And you okay, let's go on. The pores in the mask become blocked by moisture from breathing. Yep, you've got a lot of moisture, water droplets and everything in your breath, and the air stream simply diverts around the mask. Yep, there are few data available to support the efficacy of N95 or surgical masks outside of a healthcare setting. N95 masks need to be tight-fitted to be efficacious, and are uncomfortable to wear for more than an hour or two. Hand washing and respiratory hygiene. Everyone should be encouraged to wash their hands after coming in contact with people who are ill, and to cover their mouths when coughing or sneezing, which is supposed to have been taught. I wash. This is part of why I wash my hand. Anytime my hands feel sticky, there are times I'll be at work and maybe the keyboard, or maybe I've been somewhere, maybe I've held something that someone else, or whatever, and there's sweats on it, and my hands get all neck. I go and wash them, not just after I go to the bathroom. Yet people, I don't need to go out. This, so yeah, personal hygiene is not something that people seem to have anymore. So here's what's crazy, is everything covered in here. There are doctors that I know personally who were saying this is what we need to do back in February. And then some of them changed their tune. Some of them just grew silent. Okay. Because I guess they don't want to be the odd man out. But this is how we've tended to treat pandemics, and it has worked. Every pandemic, there's going to be people that die. There are going to be people you're basically the whole gamut, right? You're going to have people who die fairly quickly, people who die long lingering deaths, people who, especially something like SARS, and this is a SARS oriented thing, whether it's SARS or MERS, is it MERS, the Middle Eastern respiratory. Some people are going to have permanent scars, and they're going to have respiratory issues for the rest of their lives, and they might live another 20, 30 years or longer. Some people have scarring. Some people will get something, and then a few years later they'll get a cold, and they'll die. And it's a holdover from this. But this also happens with mono. There are people who get, like I got mono, my brother got mono, a few years apart. I got it from staying up too late when I was staying up all night doing work at college. Oddly enough, my girlfriend didn't get it, and I recovered in a few days. I had a few days I was crap. A few days, within a week I was fine. But other people will get it, and they'll get chronic mono. And every time, if they stay up too late, they have to watch their vitamin and mineral intake. They have to really be careful of stuff, or they could get full-fledged mono. Okay, diseases affect different people differently. And some people, like with this one, and I'm sure with the Hong Kong flu and all that other stuff, some people probably similar. Had it, didn't know it. And since we weren't testing everybody, we didn't know that. Basically, if you weren't sick, we weren't. And this is what and I wouldn't be surprised if this happens even with regular flu, where people will feel like crap. They'll feel kind of weird for a day or two, and they have it, but they're not in bed completely ill. This is why you look at a list of symptoms for flu. It's pretty broad, because some people get nausea, some people get massive headaches, some people have fever, some people have mild grade fever, some other people have very dangerously high fevers. It just depends, and that's just with the seasonal flu. So what I like most about this is like the voice of reason. This is what I've watched. I don't know how many videos with practicing physicians, epidemiologists, people who are in the trenches, and this is exactly what they're saying. Stop wearing all this crap. The bureaucrats are the problem. They're listening to so-called experts who see zero patients, and they're getting horrible advice. Now, whether you want to believe it's part of some conspiracy to destroy the economy and the president, that's up to you. But they are definitely following horrible policies, which have been demonstrated repeatedly. This is why this was easily, written. I mean, this looked at stuff from a long range of stuff over many countries. This is what, this is why these things are not working like people think they are. People think that by separating the disease, that people think flatten the curve is fewer people are going to die. That is not what it meant. The only thing this was supposed to do was supposed to so we didn't have a massive impact on health, the health infrastructure, the health services. Okay, the hospitals weren't overflooded. I think that was misguided, because basically you should have just canceled some surgeries, rerouted your medical staff so that people could go back to being a nurse in the ER for a few weeks because something else is no longer in use. There's a lot of specialties and things, but people have basic, I shouldn't say basic. Well, they have basic advanced medical knowledge that could have been put to good use, and they could have, even with an overflow, they could have handled it. This is why you had all these hospitals that were put up that were staffed, and no one ever came to them, because there are people in surplus, and you can redo your staff. We didn't need to go anywhere close to what we did. And once we did, and it was shown that it was BS, these people, because they're so small, bureaucrats can never admit they're wrong, in particular Democrats, and they're not the only ones. A lot of Republicans too. Here in Ohio, we have the same problem with our governor as any Democrat state. And they couldn't admit they were wrong and back away. And of course, Fauci and all the rest of them, they're never going to admit they're wrong. And Fauci Obama should have put him in jail. The stuff he was doing in his lab that Obama shut down were pretty horrendous. And this current virus is a direct path from his research to this virus, direct path. But this is the kind of stuff that actually teach. If you look at an advanced first aid class, and especially anything taught in the last 20 years, because it's gotten far more advanced than what they used to teach. I mean, the first aid pamphlet, when I got first aid merit badge it's been over 40 years ago. I don't even know if it was 100 pages. Now that same kind of course is like 1,200 pages. It's weeks long, and there's a lot of other involvement. This is the kind of thing that they'll teach you about infectious diseases like viruses. So this makes perfect sense to me. This is exactly why what we see in Sweden, in countries that didn't shut down so forcefully, they were ahead on deaths, but now they are way behind, and they are way ahead on recovery. And other countries, they're just going to keep seeing people die. All summer long, people are going to die of this new virus, and then when the fall hits, it's going to get worse because they're not going to be enough herd immunity, and it might take years to get better because of the stupidity that the governments did. And this is explaining why, in very well scientifically backed data, not computer models based on whatever. This is actual data sifted through and granted, a lot it's after the fact, but this is what we should be able to learn from what happened in the past. So I'm going to put the link in the description below. You can go and read this if you want to, look at the report in detail. That's here. I can see by the link. That's a PS. I guess it's Penn State University. I don't know, psu.edu. Check it out yourself. Read it yourself. Don't just take my word for it. But this makes perfect sense to me from what I'm observing, right? With different countries, different policies, what different countries did. And this is going to be a huge scandal. I doubt anyone will ever, but future generations are going to look back at this year and ask, what in the world were we think? Why didn't we stand up in February when this is the actual, what the medical data says to do is not what we did. We did the exact opposite of what it says to do. And we did exactly the things it said not to do and the things that were ineffective. This is like I have a computer science background, but this is like the whole Waterfall thing. The whole point of the paper is this is not how to build software. And yet the business schools and government picked up on that, and project managers and everybody, so from business, stuff. Oh, this is how to build software. And it was an example of what not to do. And that's exactly what they did. And that's very similar to this study. So there you go. I wish Dr. Bostom was still alive. He would probably be screaming at the president and the governors when they did stuff back in February and March, saying, you guys are absolutely making the wrong decisions, and I can prove it. And this ought to just end the discussion. Fully open up, go about your business, and let's just get back to work. And let's, the people who are sick, isolate them like they should be, away from you don't put them in a nursing home with a bunch of people who aren't sick from this, and then deal with them individually. And then, if you're sick, stay home. That's basically it. All right. Thank you very much. Thanks for stopping by. I know I kind of rambled on this one a little bit, but just let me know what you think. And I think this is to me very powerful, and says that definitively we have absolutely made the wrong decision. And the quicker we undo our decision, the better it's going to be. And we will see you. Goodbye. All right. Yes, but see, just like me, they long to be close to you. Why am I so loud? All right, that's why. Okay, that's good. And then we'll turn. I need to clean this thing out. The contacts. It's going when I turn it. All right, 3, 2, 1.